Welcome back to Zero World 2016. I'm your host, David Temple, and we're talking with Dr. Ryan O'Neill, Stephane Leduc, Thomas Senghaas, and Susanne Schmidinger, and we're talking about the new generation of treatment centers. First of all, hello and welcome.
Welcome. You.
Jump in there. What is, let's talk about this new generation of treatment centers. Like, for instance, how is it different from, Thomas, let's start with you.
Yeah.
You've been with Teneo for 7 years now in Hamburg. Share the difference between what it used to be like and what it is today.
Well, in my former years, beside the fact that I had a lot of problems with my back, and I was afraid to drop my job because I couldn't withstand the strain during all our days' work, I came in contact with Teneo, and I found out that the way we can put the patient in front of us, the way we can maneuver his head, which is actually the main factor in ergonomics, so I can look into my oral cavity, the way I want to sit straight up. I found out that this way of treatment usage is really the one who saved my back. And that's due to the fact that we can control everything motorized, like our the doctor's element is coming to us, and our headrest I spoke about. And I can get my knees underneath the patient because of the flat backrest. And if we put all this together, the first thing is, with these kind of treatment centers, we really can sit straight up all day. And during my work, whenever I have to bend my head to have a look into the oral cavity, I can just tip against the switch down there on the bottom to rearrange the headrest. But the second fact, what is different of these kind of treatment centers, is all this integration. Because you know, when I work, I like the work being gentle and easy and fluently like music. It has to continue. We say, in Germany, we say like a Swiss watch, you know, all these wheels going together and they really work perfect. We need that all arranged around us, the right direction, the right distance, not too far away, not too close. So you have to arrange the assistant element, the tray where you put all our instruments on, and the doctor's element. Everything has to be arranged and everything has to be integrated in there. Because of this integration, our work is running really fast, and that's earning my money. I mean, if it's awkward to do the treatment and it's difficult enough to control the patient, to control my assistant, to have 1 ear maybe in the reception what's going on, so we all concentrated and focused on that. So if the workflow is difficult, or we have to deal around with fetching from somewhere else or hand it over by the assistant, that is too awkward. So that is really the new generation of treatment center, putting everything together, concentrated on the point of the mouth of patient, and that's all around it.
That makes so much sense. You know, I never really thought about it that way as an average Joe, about how simple the mechanics of proximity and fluidity is important.
Absolutely.
Yeah,
absolutely.
Dr. O'Neill, let's ask you how you feel and what is important to this new generation of treatment center for yourself, for instance.
Right. Well, the big buzzword with the treatment centers is workflow. It does make you faster in the moment. But how often do you go to the dentist and something goes wrong and everyone leaves the room, they go bring in an entire new set of equipment, new instruments to do your root canal or do your implant. And so not only is the actual work happening faster, but the transition from one type of appointment to the next is seamless. No one leaves the room, everyone's in there. And from my understanding, these treatment centers are the first in terms of a new generation. Usually the doctor's stool focuses on the doctor's ergonomics, and the patient chair focuses on the patient's comfort. This is the first one that the patient chair has focused on the doctor's ergonomics. Thin back lets you get up close, and so really you're helping the patient and their comfort, but you're also increasing the longevity, the back pain that you have, and making more money and working longer. I mean, that alone sets it apart.
And Stephane, I want to ask you a similar question.
Sure.
Your integration and your appreciation of that workflow.
So the workflow is really what it's all about, right? We discussed this earlier. If we save a few minutes, we'll save a whole procedure, either in a day or a week or something. And this is what I think is really important,
right,
for doctors. And we've had different doctors, either for ergonomics, for the integration, like you mentioned, the design, or the experience. So we have advantages in all these kind of silos. And we apply this to all of our treatment centers. and people can find whatever they prefer. Like if they're focused on ergonomics, Dr. Senghaas, you mentioned, back pain and everything. I think ergonomics is very important. But if you think about this before you have the back pain, I think it's going to be even better, right?
Be the best.
And in terms of the ergonomics, the new generation of a motorized headrest that's quiet. What first generation of motorized anything is quiet? And so this headrest is the first of its kind, and it's quiet, and it allows you to not have to do this.
That's it.
So.
And that was your point, Thomas, right? That was That's the number one thing. It's your ergonomics that's at danger, right?
Yeah, that's my favorite, absolutely. I mean, you do a lot of endodontics, and especially if you do endodontics, you try to figure out to get somewhere in this root canal, and it's all the way back. It's never in the front. That's what you feel anyway.
Right.
So you really have to organize the head of the patient in the right position, and we have all these new facts on. I mean, there's little things, but they're so big for us. Like we have the new reciproc movement, the wave 1 we put into a Teneo and Intego. So we have a really good way to go into the root canal. And we have the light down there in the handpiece, in the contra-angle handpiece. So all these facts together make my life really easier, because it's quite struggling and quite demanding to do all this work. And the best person who can tell this is my back, actually.
Sure.
So with a treatment center like this, where everything's integrated and really works so well together, the engineers did a great job to arrange all this. That helps a lot. And this is even more than we just think in general about a dental chair. It's our daily life. And if you imagine how many hours a day a dentist is sitting on his treatment center, that is much more than in his car. And in his car, the cars are so well equipped nowadays. Obviously, our dental chairs and treatment systems have to be at least as good as our cars.
Yeah.
Even better if possible.
One of the things that you mentioned earlier is being able to change the temperature of the colors of the LED lights.
Yes.
So you can go 3200 to 5600, or rather blue to more golden hue. I mean, just that alone makes the patient experience more mood enhanced, wouldn't it?
Sure.
Yeah, it does. I mean, the whole treatment, if you have a look at it, it looks so smooth. There's no gaps in between, and if you have this for the point of view of a patient, I mean, the first contact to the doctor is on the treatment center. You may have all these nice devices like CEREC and 3D, but the first contact is the treatment center. And if you make a proposal for the treatment as a doctor, the patient has to accept it. And he doesn't see any CEREC or any 3D yet. So it is very important also for our economic success to have something which represents our kind of treatment. And if I have a treatment center from Sirona, I mean, I hear that every day where my patient come in and say, wow, what is this? Everything is moving, everything looks nice and sweet. And it doesn't look too technical. So the patient is not afraid of all this technical stuff. It's also hidden. It's like hidden back, but a lot of stuff behind. So for the patient, it's a really good experience sitting on a dental treatment system from Dentsply Sirona.
And Susanne, your job is so important in making sure that their job is easier and better and faster and smoother. And you have a very large job. What's your experience like on a day-to-day basis in making sure their job is easier?
Yeah, I mean, what we are doing is really to develop, to design together with dentists treatment centers for better, faster, safer dentistry. And in daily life, it means to work very close together, to listen, to observe, to understand in detail what is needed. And so we managed to have this new generation of treatment centers. I believe a very good combination of an aesthetic value, very good design, connected with very advanced technology. And as we heard here, I mean, we are very happy that the treatment center as a centerpiece of the dental office is really perfectly connecting the patient experience, the patient communication on the one side, X-ray diagnostics, and the integrated endodontic and implantology treatment.
Wow. Well, folks, thank you so much for your time. We've covered a broad spectrum of this new generation of treatment centers, and I really appreciate the input and the insight. You guys are so passionate and excited about it. You know, we were talking earlier about how we can get geeked out about nice equipment, but
Yeah.
it does make all the difference in the world when you combine integrated workflow and ergonomics,
Yeah.
saving backs and making people happy.
Absolutely.
Enjoy the rest of the show. Thank you so much.
Great.
Thank you.
Thank
Thanks
you.
for having us.
And we'll be back with more Zero World 2016 right after this.